everyone. It's your good friend Wendy, and you're listening to the Reaching Out with Reach podcast. This is the show that brings you discussions and topics surrounding our community, prevention, and recovery. All right, today we have Tom Kowach joining us, and he is the Director of School Programs at Reach. Hey, Tom, how are you doing?
Good. How are you doing today?
I'm doing good. Thanks for coming on the show. So can you tell us a little bit about what you do at Reach?
So as the Director of School Programs, essentially, I coordinate the different outreach, education, partnership initiatives that we do with various school districts. We serve pretty much all of Ellis and Johnson County, and we work with pretty much all the school districts in those counties in some capacity or another. Sometimes we do one-time events, one-time presentations, different activities. Sometimes that could be things during Red Ribbon Week, which is a big week about talking about drug prevention and making healthy choices. Then that can also look like curriculums, which are multi-session evidence-based programs. But essentially, that's kind of the general summary of what we do and how that works.
And you're going into what kind of schools at these districts?
So we do all levels. So kinder basically through high school. Now, in most of the elementary schools, so kinder through fifth in most of the schools that we work with, a lot of those schools like our small group prevention curriculums. So we basically work with the schools, work with the parents, work with teachers, and they can make recommendations on their students that they think would benefit from a little extra time working in a small group with other students, just working on things like decision making, setting goals, making healthy choices, what healthy relationships look like, and managing your emotions in a positive way. So that's one of the primary services we provide to the elementary schools on a consistent basis. Then for our middle schools and junior highs, we have a different type of curriculum that focuses also on life skills, so same kinds of general concepts, decision making, healthy relationships, managing emotions. But then it also has a more informational, educational component added onto it that does go over how specific substances of misuse and abuse can have a negative impact on students' goals, on their relationships, and it's just basically the goal is to help them understand how substances that can have these negative effects can impact them now and in the future, and how they can affect other people. Then in the high school, it's basically a similar program to what's in the middle schools, just age appropriate for high school students. And then we also work a lot with the alternative school programs and provide services for the kiddos in those schools as well.
That's awesome. So it sounds like you're doing a lot of prevention for, at least the middle school up.
Absolutely.
Tell me more about that.
Yeah. So prevention in general, it's pretty much what most people think when you hear the word prevention. It's basically trying to build up, we call them protective factors. It's trying to build up more of those protective factors. The more protective factors you have, the more likely you are to make healthy choices and avoid unhealthy choices. And then the goal is to also reduce risk factors. And those risk factors are things that tend to make it more likely that someone will choose to get involved in some of the potentially harmful lifestyle choices. So the prevention educates, informs, creates hopefully positive environments where students, youth, family can be equipped to make good, healthy choices, and ideally we're looking to prevent that behavior before it becomes an ongoing issue that requires treatment, recovery, and things like that.
Yeah. So you mentioned something about risk and protective services or factors. What is that?
Right. So protective factors there's a lot of different examples, but basically these are the positive characteristics, the positive environmental factors around you, the positive positive influences that are going to be around youth, family, communities. So, some individual examples of protective factors can be things like a positive self-image, self-regulation and control. So that ability to manage your emotions, that ability to consider your choices, and then social, the ability to be interactive in a social setting. So those can be examples of some types of individual protective factors. So then the flip side of that might be an individual risk factor would be something like if there's a genetic predisposition to certain to the influence that certain substances can have. There's lots of research out there that shows how some people are more susceptible to addiction or substances of abuse having a greater impact than maybe for others. The environment around that person. So if others in the family unit are using substances, using alcohol, that increases the chances that the youth might be involved with it as well. If the individual doesn't have or has poor impulse control skills, that's another individual risk factor. So, it's working really hard to balance those. We want as many protective factors out there as we can. And the greater the protective factors, the more protective factors there are, the better equipped individuals, families, communities are to make healthy choices. Some more examples of other protective factors could be things like positive parental involvement. Parents that, they talk a lot about how much the impact of just sitting down for dinner with your family, talking about your day, asking kids about the day, kids asking their parents about their work and what they do. But just that interaction, that consistent interaction, just simple things like that have been shown to make a huge positive impact. Another one that gets a lot of attention in the prevention world is peer disapproval of substance use as a protective factor. So the peer group that youth are in can have a lot of influence over the choices that individuals will make. So if you're in a peer group, so if the friends, the people that are around you don't find it acceptable or positive to be using substances, alcohol, drugs, tobacco products, vapes, things like that, that's a positive protective factor. And then there's the flip side. If the peer group that you're around doesn't have a disapproval or has a view that is not concerned, there's a lack of harm involved associated with the substance, then it increases that risk factor. So that's kind of that flip side. If that's why it talks about, the people you hang out with can have an influence over the choices you make. So that kind of ties into then the curriculums that we implement. As far as, it's not what some of us grew up with, maybe in the 80s and 90s when it was more fear-based tactics, when it was more of, don't do this. These are the horrible things that will happen to you if you do this. Because, when we did the research and saw the outcomes of those types of programs, they could have some potential positive effects, because you are informing and educating. But when that's the focus, it tends to actually, those that experience it or see that type of substance misuse, they don't see all of those really scary things happening all the time. So they start to think, oh, well, the messaging I was receiving isn't accurate. It's not true. So it's probably not going to happen to me because, I have this person that I know that uses the substance and these horrible things that the presenter, the teacher came and told me about aren't happening. So when it's fear-based, it tends to sometimes it can have the opposite effect of what we're hoping for. So with the education and curriculum that we currently use and what prevention science is showing us now is the importance of really building up those protective factors, really building up those skills that again can enable us, that can enable our youth and our families to make positive, healthy choices. Some other examples that you can see, like in a community setting, for a protective factor is, things like available after school activities. Having positive, healthy activities that youth can get involved in and enable them again to do things that they enjoy, that their peer groups enjoy, without feeling the need to seek out riskier behaviors. So, and then another example too would be low perceptions of usage of substances, because I mean that's one thing that we talk about when we go into our schools is we ask our youth, how many of you believe that the majority of people in your school, in your grade level, use alcohol, for example? And a lot of times you're going to see an overestimation of what the youth think and what really the reality is. So that can factor into, again, that social norm acceptance. Mm-hmm. If we think that everyone else is doing it, it feels easier for us to do it. But if we think no one else is doing it, if it's not socially acceptable, then that can have an influence that we're less likely to want to try it, to partake, to get involved in it. So, that's a big part, again, of the awareness and the curriculum that we're trying to implement, is trying to, show kids that the majority of your peers are not using these substances. Now, those trends can change over time. It can vary by grades. It can vary by a lot of different factors, but still the majority are not. So that's become another component of what prevention's kind of shifting towards, is really trying to focus on those positive outcomes, as opposed to, we know there's concerns out there. We know there's concerns with vaping. We know there's a huge concern with opioids and fentanyl. Those are all very concerning, dangerous substances that have some very negative health effects that, are frightening and are cause for concern, and are things that absolutely need to be addressed and are being addressed. At the same time, when we look at it from the prevention standpoint and trying to curb or prevent those behaviors, focusing more on that positive, that the majority of people aren't doing this. The majority of people are making healthy choices. They are choosing healthy lifestyles. They are choosing to make decisions that will impact them and their family and their peers in a positive way now and in the future. Focusing more on that messaging is something that there is more and more of a shift going towards, and I think it's a very good shift, and I think it's something that I think our society and country can use that breath of fresh air of positivity in that regard. And so then one other kind of example of a positive protective factor is on a more environmental, societal level, is limiting availability of substances. And this is where local ordinances, this is where certain laws can come into play. If the legal age of something is 21, and if that law is enforced, then access to that substance is more difficult. So simply making access more difficult has an effect on not only people's ability to get that substance, but their perception of that substance. So that's why there is a push to have, smoke-free counties, smoke-free states. That's why there are the enforcement of carding for tobacco products, because that's been shown quite clearly to have a positive effect in reducing substance misuse. Again, the flip side of that is that if those laws are in place but are not enforced, that's a risk factor, because there's sometimes laws are there, but they're not always followed through with, and that can actually not only counter the effect of it, but actually reduce that perception of harm. And that reduced perception of harm, again, goes in line with having an influence that can make youth use more likely, or family use too more likely. So, yeah, that's kind of what we're looking at a lot of times when we talk about risk and protective factors, and they're key components of prevention services, and how we get prevention services to work, and how our evidence-based practices they're based a lot on those risks and protective factors.
I really like the part that you said that, back when we were younger, it was more fear-based, and now things are more information-based. And I really like that that's what we're leaning towards with this, this generation, I guess.
Yeah. And I'll be one of the first people to say that the fear-based stuff worked for me. I remember, having the police officer come in and tell me about the things that can happen if you become addicted and overdose, and it terrified me. Now, you can look at, there's probably a lot of other factors that went into my perception of that. My families, were not, they didn't use alcohol, they didn't use any of these substances. That they had very much had that messaging was already kind of planted in me on the family level. But that, again, that just kind of goes to show you the impact that families can have.
Yeah.
And families are I strongly believe, and I think the research backs it up, where it says, families are pretty much the strongest influence on youth's choices in a lot of ways. Definitely the impact that substances can have on their choices. The example that you set for your children, that's going to be one of the biggest factors that are going to influence what your children do. Now, it's not the only one. There's plenty of examples of that as well. But the more likely, the more of a consistent messaging and example of action that a youth has from their parents. They don't just say, "Don't do this," but the parent doesn't do it as well. That's a major component in the influence that it's going to have on kids' choices. And that's just not about substance use. That's across the board.
By example.
Exactly. So it's a lot of these tenets that I think, we talk about, we have in mind, we consider, we've been taught ourselves, and we've been taught these things throughout much of humanity. Sometimes we just have to be reminded of, how simple it can be. Might not always be easy, but it can definitely be pretty simple.
So I'm just curious, what kind of feedback or results are you seeing from doing the curriculum in schools?
Sure. So one of the things that how we evaluate the effectiveness of the programs is that for it to be evidence-based, you have to be able to evaluate how well it's received and how well the messaging is comprehended. So we always do like a pre-questionnaire to get an idea that from the youth that we're working with, and essentially it asks questions that are focused on perception of harm, perception of peer approval. So we always do that, and at the end of the sessions, which most of our curriculum are either 8 to 10 sessions. We do the same questionnaire again that asks a lot of those same questions, and we evaluate, compare the pre-questionnaire to the post-questionnaire, and see how those attitudes could have shifted or maintained. And it's one of those things that they overwhelmingly either stay positive or shift in a positive way, and it's one of those things. Prevention can be a challenge at times because it is a very holistic approach to be successful. Like, it requires a very holistic approach to be successful. You can't just do one thing and expect people's perceptions and social norms to just change because of one curriculum that you do at a school. It really is a environmental, multi-level, multi-sector discipline that requires a lot of different buy-in from different people and different levels of society, different levels of family, different levels of local businesses, government, local government, things like that, law enforcement, schools. It really does require the whole society, the whole community to come together with similar messaging to have a positive impact. And that's one of the great things that, we see when we see communities being willing to recognize that certain things that have been socially acceptable for a time are shifting more towards, hey, this really has a very negative health impact. Just things like smoking ordinances, smoking in restaurants, Those are things that were shown to have a negative impact, not just on the individuals that were using, tobacco products in restaurants, but a big impact was on the workers. So the waitress, the wait staff, the cooks, the busing people, they're constantly being exposed to this secondhand smoke and chemicals and things like that. So you see the shift in a positive way about prevention when you start seeing that these things that, again, in the past were socially acceptable and normal, are now shifting towards, okay, this isn't something that we necessarily want, not just ourselves when we go to the restaurant to be exposed to, but we want to look out for the workers as well. So we're recognizing the dangers, and we're creating protective factors with laws and ordinances to protect people and shift those what were norms to new norms. Again, that have a positive health impact and a positive outlook on individuals and on the community.
That's really awesome. Well, do you have anything else you'd like to share about the prevention world?
Oh, just that I'm thankful to be a part of an organization and a program that cares so much about the community, that cares so much about the people we work with. We care about the schools, we care about the students and the teachers. Yes. We care about our community partners. It's why we do what we do, because we want to see everyone have the best possible opportunity to grow and thrive. Many of us, I think, that are in this work have seen the negative effects of the substances that are out there, both illicit and legal. And we see how much of a negative impact they can have on individuals, on families, on communities. And we want to do what we can to equip our communities to make good, healthy, positive choices and reduce that negative impact. And yeah, I'm very thankful to be a part of that.
Yes, me too. All right. Well, hey, thank you so much for joining us on the show today.
Thank you. Thank you for having me on.
Yeah, we'll do this again sometime.
Sounds good.
Well, that about wraps up our episode. As always, if you're wondering how you can help, you can join our coalition meetings. You can also support our youth and family programs with a tax-deductible donation or food gift cards. And if you have any questions, you can email us at info@reachcouncil.org. That's info@reachcouncil.org. Or you can follow us at Reach Council on Facebook or Instagram. Thanks for listening to our show. Stay tuned for ongoing monthly podcasts from our Reach teams on all things prevention and recovery. So remember, life is full of choices, so choose happy and choose healthy. Bye.